Hello, everyone. This is Dr. Richard Fleming. Today is Thursday, the 21st of January, 2021. As a boy growing up in Iowa, my parents and grandparents, along with a number of the older individuals, had an interesting expression for scenarios that we're experiencing today. Too many chiefs and not enough Indians. The expression meant that there were too many people trying to determine what should be done and too few people actually doing it. The practice of medicine comes down to what doctors, either allopathic or osteopathic doctors who've been trained in medical school, decide is appropriate for the diagnosis and treatment of whatever health problem you have. SARS-CoV-2 is no different. Although for the last 13 months, we've had enough interference with physicians practicing medicine, interference that has come in many cases from NIH, Health and Human Services, the FDA, CDC, World Health Organization, Public Health Services, and similar federal and international agencies. Interestingly enough, when you go to the hospital or doctor's office to be seen, you'll not find any of those agencies actually there to take care of you. That will be the doctor and his staff, including the nurses and the rest of the hospital personnel, responsible for taking care of you and following the orders and instructions of the doctors. So why is there so much confusion for doctors about what to do? It comes from the very top. It comes from those that are generating opinions about what is and is not safe for your doctor to do, and the concern that your doctor has about whether they'll lose their medical license if they do something that the people in power, all the Indian chiefs, don't like. During the last couple of days, I've received a number of telephone calls and emails from individuals asking about Ivermectin as a treatment for SARS-CoV-2. A group of doctors called the Frontline COVID-19 Critical Care Alliance have been promoting the use of ivermectin, as a number of other doctors have been promoting the use of hydroxychloroquine and antibiotics that interfere with the virus itself, and other treatments that there's evidence to show that these treatments actually benefit people with SARS-CoV-2, successfully treating them. But because of the powers that be and the interference, many places have doctors that are afraid to use these drugs because, again, they're afraid of losing their medical license. There are a number of very well-known doctors and very well-qualified doctors in these groups, including Doctors Barron, Merrick, and Corey. Back in December, this group of physicians issued a statement that they believe that ivermectin is the potential solution to the pandemic and will change the face of this disease worldwide. I would agree that ivermectin is one of the potential solutions because there are a number of treatments that physicians have available if everybody will quit policing them, quit interfering with the practice of medicine. That's why this organization called upon national health authorities to swiftly review the comprehensive medical evidence and issue guidelines for doctors to begin immediately prescribing ivermectin. Now, my only concern is the issuance of guidelines. Most doctors are able to come up with the information to know how these drugs should be used, and these other doctors are more than happy to share their knowledge and information that they've been obtaining to allow doctors to know what the doses are and the prescribed schedules, how often you should get these drugs. But interestingly enough, this was back in December. And I think we're all painfully aware that there's been, in the United States at least, another couple 100,000 dead Americans because treatment is not being provided to patients either in the outpatient or inpatient setting. Ivermectin is available in both settings, as is hydroxychloroquine and almost all of the medications that we've talked about. Many people got excited during the last couple of days because they had seen a newspaper heading and heard in the media that NIH relaxes its prohibition. Well, a drug that's approved by the FDA, in which ivermectin, hydroxychloroquine, and these other drugs that we've been talking about are all FDA approved, can be used for any other purpose that a physician deems appropriate. That's called off-label use. And the reason why off-label use exists, at least one of the reasons, is because if a drug is shown to be useful for something, but it's already been approved for something else, rather than denying patients the ability to receive that drug for treatment, and rather than the drug company having to go through another round of FDA approval, doctors are allowed to prescribe these drugs off-label for you, the patient, to benefit. So, a statement that suggests that somehow the NIH somehow has the ability to prohibit the use of ivermectin does disservice to this entire system. NIH doesn't have the legal authority to inhibit or prohibit the use of any medication. And this threat that has been held over physicians by federal agencies, should we use medications that you don't like, this has interfered with the treatment of patients. And as I mentioned, in the last couple of months, we've seen a couple 100,000 more Americans die for lack of treatment. You would think that somehow this newspaper heading would suggest that the NIH is saying, please, by all means, use this. This is not what the NIH is saying. Their policy simply now states that the COVID-19 treatment guidelines panel, the panel, has determined that currently there are insufficient data to recommend either for or against the use of ivermectin. That's not exactly a glowing testimonial. However, these doctors know better, and they would like to see you being treated with drugs already FDA approved by doctors that have the medical licenses to prescribe medications to determine your treatments to stop this pandemic. A vaccine will not do that. The vaccines will not stop the pandemic. And currently, they are truly experimental. They required an emergency use authorization that was only possible because these federal agencies have refused to acknowledge that treatments are available. Take a look at these doctors and what they have published. Here's an article from the New American, and you can see that these doctors are well qualified to present the argument for ivermectin. If you look at Dr. Corey, he's the president of this group. He's the chief and critical care service and medical director of trauma and life support at East Virginia Medical School. He is tenured professor of medicine and chief of the Division of Pulmonary and Critical Care Medicine. Both of these medical professionals, Dr. Merrick and Dr. Corey, are more than qualified to provide their input on what they believe the right treatments are. Ivermectin represents one opportunity for treatment that doctors should be able to provide you because the FDA has already approved this drug for another use, and under open label practices, your doctors should be able to prescribe these drugs. Rather than watching people come into a hospital and tell you we have no treatment for SARS-CoV-2, ask your doctor what information they have about possible treatments for off-label use for drugs to treat SARS-CoV-2. We can put an end to this pandemic and people dying, which is the real problem behind the pandemic, while we address the issue of the spread of the virus. But if we stop people from dying because of treatments that already exist, the fear and the stress and the concern that is running amok throughout the United States and the world won't have a reason to run amok. And the people that are controlling a scenario and want to be in charge, all the Indian chiefs who really don't have any answers, will have to yield to the Indians, all the doctors, providing care and treatment to you, your family, and your loved ones. The next time somebody says there aren't treatments available, merely ask them to look for the information that's out there. It's an interesting statement that the NIH can no longer oppose the use of these drugs. Federal guidelines allow physicians to treat patients based upon physicians' decisions on what drugs to use, either on label or off label. This is Dr. Richard Fleming. Today is Thursday, the 21st of January, 2021.